If you've had a hysterectomy, you may think once you're healed, you're really in the clear. But did you know after your uterus is removed, this creates a lack of support around the pelvic area, and it can put you at a bigger risk for pelvic organ prolapse. But have no fear. I'm going to talk you through some of the things that you can do to prevent prolapse from happening after a hysterectomy. And pelvic organ prolapse is when those pelvic organs, they shift downward, can put pressure against that vaginal wall, sometimes creating this pressure, heaviness, this feeling of uncomfortable, even bulging area down into the vaginal area, into the rectal area around your pelvis. And it can be really uncomfortable, especially if you're walking for a period of time, standing for a period of time, or just getting more active, but you don't have enough support around that area, so your muscles need to kick in and do more work. I'm not just talking about squeezing and doing Kegel exercises, it's much more than that. So if you've been experiencing any changes in bowel or bladder function, or changes in how you're feeling, like pressure, heaviness, something uncomfortable, and you've had a hysterectomy in the past, well, then you want to listen to this video, because I'm going to talk you through the 5 signs of pelvic organ prolapse after a hysterectomy and what you can do about it. So after a hysterectomy, the lack of uterine support can really put some extra strain on the bladder and on the pelvic area. You lose some support there. So what do you need to do to actually create more support there? So sign number 1, you do feel more of that pressure or heaviness in the vaginal area. Symptoms may worsen from standing long periods of time, or from walking or doing anything where you're really upright and in a gravity position for a period of time. I have seen nurses or teachers, people that might spend a lot of time standing, and their symptoms get worse at the end of the day, or they're just feeling this uncomfortable pressure or heaviness, even lower abdominal discomfort or lower back pain that happens more at the end of the day. So that could be a sign that you have a slight prolapse. Not to fear, but some exercises are going to be very helpful and beneficial to work in, especially in this recovery stage after a hysterectomy or down the road. It doesn't matter how long it's been since you had surgery. You can always make improvements with those muscles too. So doing a restorative and Pilates-based mat routine that is taught by a physical therapist who knows what they're cueing and talking about with Pilates-based exercise and the pelvic floor can be extremely helpful. I do have a hysterectomy recovery program and a pelvic floor Pilates program that can take you to that next level, so you feel like you have more support around your pelvic organs. I'll link to that below. But having any of that pressure or heaviness, this is a really common symptom and sign that there might be a prolapse. So seeing a pelvic floor physical therapist can be very beneficial. Now, sign number 2 is feeling of a bulging or something falling out. I've heard women say before it might feel like they have a tampon and that tampon is starting to fall out. That can be a very common symptom or a common sign of feeling like that vaginal wall is weakening and you're getting more pressure down there. Some women may even see at a later stage prolapse, a stage 2, stage 3, 4, that they actually see a bulging through the vaginal area or through the rectal area when they're looking down there. So don't freak out if that happens. I promise there are non-surgical ways that you can improve those symptoms, and even a device called a pessary, seeing a pelvic floor therapist that is going to guide you in the right direction with what you can do to avoid surgery is going to be very helpful. Now, the exercises that you're doing and learning how to hold those muscles and support, especially if you're lifting anything heavy, you want to make sure that you're exhaling and breathing out as you're lifting anything, or if you're doing exercises such as like squats or lunges, that you're really exhaling and pulling the pelvic muscles in and pulling the lower abdominals in as you're lifting. that is going to be crucial. So learning the right strategies of how to lift properly can prevent your symptoms from getting worse and even improve your prolapse symptoms too. The most common types of prolapse after hysterectomy are bladder prolapse, called a cystocele, a rectal seal or rectal prolapse, or even a vaginal vault prolapse where those vaginal walls have also collapsed or you have less support there. Sign number 3 is that you have any changes in your bowel or bladder function. Maybe you're rushing to get to the bathroom, you're having some leaking, or you're feeling extra strain or discomfort. It's more difficult to have a bowel movement. These can all be signs of a possible prolapse, either rectal or a bladder prolapse. And some women may feel like they can't empty their bowels all the way, or they actually have to help themselves have a bowel movement or even sit on the toilet a little bit longer after they go to the bathroom. So these are all signs that you may have a prolapse, but once again, learning the right strategies or even checking in with a pelvic floor therapist is going to teach you what to do, what not to do, and bathroom habits. One of the key things with this is preventing constipation. So if you are looking at trying to get more fiber in your diet, staying hydrated, making sure that you're checking in with your nutrition so you don't get constipated and doing more natural things, that also will prevent that prolapse from getting worse if you're having any uncomfortable feelings down there. Same with bladder prolapse. Having any leaking, you still want to drink water. You don't want to just hold off on your beverages, but cutting back on things like caffeine or citrus, carbonated beverages, even sparkling water, things like that are going to give you the urgency and be more bladder irritants. So that way you'll feel like you have to go more often. But we actually want to stay hydrated and really fill that bladder. But learning the right strategies with that is going to help your symptoms. Number 4 is pain or discomfort during intimacy. So a lot of women, they're fearful to actually be intimate with their partner or have any kind of penetration in that area, but it's not going to make the prolapse worse. It's not going to damage this. I get asked this all the time. And can I still have intercourse with my husband if I have a prolapse? And yes, you can. It may feel a little bit different. It may be a little more uncomfortable, but it's not going to harm anything. But this may be a sign that those connective tissues and structures down there in your pelvis need strengthening, need more support, and therefore your sexual function is going to be a lot more enjoyable if you're working on the right things and exercises to help it. And number 5, sign your lower back pain is not going away. Maybe you're getting this new aching in your lower back, or you're trying some things for your lower back and it's just not getting better. So having a weakness and lack of support around your pelvic organs and around your pelvic muscles does affect your back, because those muscles are all connected, and it really is that support around your pelvis, which therefore can impact your lower back. Some women will even get some hip pain or tailbone pain or discomfort. And also too, everything is connected there. So with that, you want to do some exercises that are really going to strengthen the glute muscles, those butt muscles, in doing glute bridges. I have more videos on prolapse on this channel, and I do give some specific exercises that can be very helpful. Glute bridges, doing deadlifts, squats, things like that, where you're really going to be working those butt muscles, and glute muscles are your biggest support around also supports your lower back. So not only the pelvic muscles, but also around those bigger hip muscles can be very helpful for supporting your back and helping with back pain too. So what to do if you notice these signs? I gave you some tips along the way, but you also want to make sure that you're not having any excessive straining. So you're really learning how to breathe properly when you're lifting, or if you are having a bowel movement, that you are using something called a squatty potty with your legs up in a position where you can open up the pelvis a little bit more, so you're not doing excessive straining and you're not bearing down and pushing down through your pelvic area for too long. Those things are going to make prolapse symptoms worse. And without the uterus there, you will have some weakening and some changes around that pelvic area. So we want to make sure that we're doing things that are going to prevent this and make you feel confident about your body moving forward. Having a hysterectomy comes with a lot of questions, and with that, I have a hysterectomy recovery program that I linked right below this, and I hope you found this video helpful. And don't freak out. If you're having any of these signs, you can get help, and can get help of someone like myself, a pelvic floor therapist that is going to guide you in the right direction and answer your questions. So thanks so much for watching, and I wish you the best with your healing and recovery. Even if you've had a hysterectomy a long time ago and you came across this video looking up your symptoms, don't worry, you can still make big improvements if you're doing the right types of exercises and these lifestyle tips that I taught you today. So thanks so much for watching. We'll see you again in another video.